Hi, everyone. I am Lancet, and I'm a dental hygienist. And I am so excited to share some helpful tips with you that I have to help you keep your smile feeling and looking great. Maintaining good oral health is crucial for teens, high schoolers, and everyone really, especially young adults, though. First and foremost, our mouth helps us eat, chew, swallow, smile, talk, and laugh, but so much more than that. Our mouth is a very important part of our body. And believe it or not, our mouth significantly impacts more than just these things. It actually affects your whole entire body. Poor oral hygiene, not taking care of your mouth can lead to various issues like gum disease, cavities, bad breath. We know all of those things can affect our confidence and our self esteem. But more importantly, problems in the mouth don't just stay in the mouth, they actually travel to other parts of the body. They can create inflammation, infection, and problems with the brain, the heart, our skin, our organs, and so much more. In fact, most cancers in our body now have some sort of a connection to all of the bad bacteria that are growing in our mouths. So now is the perfect time to develop healthy routines to help take care of your mouth. One thing that I do want to talk a little bit about is vaping, juuling, the use of e-cigarettes. It is very harmful to your entire body, but we know it's very harmful to your brain. In fact, if you vape under the age of 25, it can permanently alter your brain, parts of your brain that are responsible for intelligence, language, and memory. We know that vaping is one of the fastest ways to get chemicals to the brain and can negatively impact brain development. In fact, we know that vaping has been linked to seizures in people under the age of 25 since 2010. Vaping is also linked to different types of lesions, irritations, ulcers, and sores in and outside of the mouth due to chemical and heat burns. Also on the face and on the hands, same thing, burns and explosions and poisons due to the chemicals and heat that are in vaping devices. We also know that vaping damages the skin. It makes the skin of the hands and the face age much faster than if you don't vape. Vaping is also linked to an increased risk of skin problems like acne, heat, and damaging chemicals. Our body doesn't like them and it has a very hard time repairing and having good cell turnover. And secondhand vapor is as dangerous as secondhand smoke. We know that vapor that's coming out, it's not a water vapor. It's actually called an aerosol vapor. And inside of this aerosol are really harmful chemicals like nicotine, formaldehyde, and different types of chemicals that are linked to cancer. In fact, there's 100 different toxic chemicals in secondhand vapor that are linked to cancers, as dangerous as air pollution, as dangerous as secondhand smoke. So all of that secondhand vapor is not healthy for us either. So vaping has been linked to damage our lungs, damage our brain, and I want to talk to you about how it damages your mouth. We know that vaping is now considered as bad as smoking traditional cigarettes when it comes to our health, and especially the health of our mouth. There's heat, there's chemicals, there's pesticides, and there's sugar or flavorings that are inside of these liquids that can be very harmful to our mouth, increases the risk of cavities, gum disease, and a whole host of other things. In fact, there is the same amount of nicotine in one small little jewel pod as an entire pack of cigarettes, about 20 cigarettes. So vaping dries out your mouth. It changes the type of bacteria that grow in your mouth. So we have a lot of bad bacteria and very, very little good bacteria. So vaping has been linked to dry mouth, gum disease, red puffy swollen gums, more tartar buildup, and increased risk of cavities too. There's also this condition called vapor's tongue, where the oils in these liquids actually coat the tongue, causes changes with our taste buds. So vaping alters our taste and smell because it alters the environment that these, parts of our body are exposed to heat and chemicals and liquids and oils. So inflames the lining of the nose, inflames the lining of the mouth, alters our sense of taste and smell. So I'm here to encourage you to be mouth healthy. Make sure you're getting regular dental checkups. Make sure you're seeing a dental hygienist regularly to get your teeth cleaned, to have sealants placed on your teeth, to have fluoride varnish placed on your teeth that will give you months of protection. In fact, I may even be coming to your community or one of your schools soon. So if you see forms go out asking you if you would like free dental services, please sign up. And I would love to have a chance to meet all of you. It's also really important for us to be great brushers, brushing our teeth at least 2 or 3 times a day to get all these harmful chemicals and bacteria and viruses and fungi and parasites, get all of those things off of our teeth. We should be brushing 2 to 3 times a day for 2 minutes, brushing in slow, soft circles. Don't brush super hard and fast, slow, soft circles. But brushing only cleans about half of your mouth. So you have to use something else to clean the other half of your mouth in between your teeth. So floss, or my favorite gadget is a water pick. Squirting water in between your teeth actually breaks up a lot of these really harmful things that we're talking about. So brushing 2 or 3 times a day, 2 minutes, brushing slow, soft circles, using something like a water pick in between your teeth every day to clean the other 50% that your toothbrush can't get to. Making sure you're getting enough sleep. You should be getting 7 to 9 hours of sleep. That's when our body rests and heals and repairs. And so if we're not getting enough sleep, we can't be healthy. Drinking enough water. You should be drinking half of your body weight in water every single day. Eating really good, getting lots of good nutrition, lots of fresh fruits, fresh vegetables, food with lots of color, food that doesn't come in a package, minimizing fast food and processed foods and sugar. That's how we keep our mouth healthy. And I cannot say enough how important it is to avoid liquids that damage your teeth. The problem with a lot of liquids now is they might be sugar free, but they are filled with acid. Very, very acidic drinks like energy drinks, Gatorades, sodas. It's the acid that's almost as bad for your teeth than sugar is. So making sure that liquids aren't constantly, bathing your teeth in acid that could be damaging the enamel of your teeth. And lastly, another really important tip to keep your mouth healthy is to breathe through your nose. Breathing through our mouth is never healthy for our whole entire body, but especially bad for the health of our mouth. The only healthy way to breathe is actually in and out through your nose. So, nice deep breaths through your nose, making sure that your mouth isn't open while you're just breathing at rest or breathing while you're exercising. And we definitely do not want our mouth open at night while we sleep. That allows a lot of bad bacteria to grow like crazy. It dries out our mouth, alters our immune system, and breathing through our mouth also alters how we grow and develop. So, breathing through our nose is good for our immune system. It's also good for our mouth health and good for how we grow and develop. So, I'm just here to say thank you for a few minutes of your time. You have such an amazing and bright future ahead of you. Decisions that you make now are setting you up for a lifetime of health. And I hope that you choose to protect your smile too. A dental hygienist is always here to help you. I'm Lancet with Community Dental Connections, and maybe I'll get a chance to see you guys when I come to your school or your community. Thank you so much for a few minutes of your time today.